Okay, welcome back everybody. It is Wednesday, November 4th. I'm back here with Dr. Gary Green. Unfortunately back with a story that appears to never end, but more information about COVID that we hope will be useful for you. Gary, let's just start off by what's the global epidemiology doing? We see stuff about getting dramatic in Europe, and we're still kind of flat here, so where are things at?
So yeah, things are very dynamic with the virus right now. Worldwide, things are in different states and different fluctuations in different parts of the world. So right now in California, we're on the back end of the first wave. And so we're trying to get those numbers down lower. And I'm going to show you a graph of this. So this is a graph of California, and it shows that the first wave in Northern California hit probably in late July and early August. But now we're at this tail end where we can't lower the numbers anymore. We don't know if there's a slight uptick recently in California, but certainly it's not going down because sometimes it undulates. Worldwide, things are different. So in Europe is having the second wave right now, and it's been dramatic. Belgium, the UK, France, I think Italy have really locked down their economies and their countries again, and some borders are closing. The Midwest in the US, the Midwest is at the peak of their first wave. So the Midwest is where we were a month ago. And so we're on the back side of the first wave. So it's very dynamic. Probably the East Coast will go into their second wave pretty soon, and then we'll probably follow in the second wave after the holidays, or in the middle of the holidays.
It's very dynamic, but it's also kind of suspenseful because we're all just kind of waiting for the shoe to drop, aren't we?
And Gary, the other thing that's important, and I'll show this in the second graph, is what about locally?
Okay.
Locally, this is Sonoma County. And people wonder, why isn't Sonoma County locked down? Why haven't we opened the environment? Why don't we have indoor seating? It's because our numbers look like the California numbers, but on the back end, we haven't really locked things down in Sonoma County with outbreaks in certain vulnerable populations, like nursing homes. So there's been a lot of chatter about this. Sonoma County's had 1,600 cases. That represents 0.31% of our population. That means there's a lot of people still available and vulnerable to becoming infected.
So Gary, we've been fighting this now for 8, 9, 10 months or even more across the world. What can you say is happening to the overall mortality given the learnings that we have?
So we're learning about mortality. We don't think the virus has mutated yet enough to be more virulent or less virulent. Maybe there's a different clade out there that's becoming more contagious. That we don't know, and that's being looked at. But the severity of the virus hasn't changed, but we're learning more about its mortality. So case fatality rates and mortality are different. Case fatality rate means of everyone diagnosed or everyone hospitalized, how many survive. But what most people want to know is if I just get this virus, what's my survival? And that's mortality. Well, the Imperial College of London just did a study in the end of October, and they did a meta-analysis of like 175 studies throughout Europe and in the United States. And they found out with really good modeling that the overall mortality rate for in the developing world, a third world country, is about 0.23%. So, and that for the flu is actually 0.1%. So in the developed world, counterintuitive, the mortality rate goes up to 1.5%. No, 1.15%. So why is it higher? Because in the developed world, the elderly are surviving. We have more of a vulnerable population here based on age. Well, what's also interesting in this study is they show that every 8 years, the mortality rate will double. So you go from 0.01, 0.02, 0.04, it'll double every 8 years. So in this study, under the age of 30, the fatality rate was 0.01%. But over the age of 80, the mortality was 7.3%. So that's significant. It just shows us again that the elderly are very, very frail for this virus. That compares to influenza. Influenza mortality is 0.1%. But for COVID, if you're over 80, 7.3%. So that's a significant difference.
Gary, have we seen a significant decline in mortality, somebody who contracts this month versus April?
Yeah, in the United States, two things have changed. One is, as we become more systematic, our overall mortality has improved. From in March, it was about 26%. Now in the nation, it's 8%. And I think at our hospital it's probably even less than that.
Good.
So, and also the duration for patients to be ill is less. So patients get out of the hospital earlier, and we have more survival there.
Good. Can you tell me about where we're at with vaccines, or is there anything new on the horizon you can tell us about?
Yeah, so there are 5 vaccines in phase 3 study. I'm actually was just on a committee meeting today about vaccine preparedness. So far, all vaccines have not stalled, but the companies are being less transparent about the information with the vaccine. I still think we're going to have the first vaccine in January, and probably the Moderna vaccine, maybe the Pfizer vaccine. New, though, is monoclonal antibodies. So we've never talked about that, but monoclonal antibodies are sort of the new wave of treatment, but you have to be careful about monoclonal antibodies. They're being studied, and my personal take is I think convalescent plasma, which is a polyclonal antibody response for people who recover from the virus, is going to be as effective or more effective than monoclonal antibody. But it's in the news because Trump got Regeneron when he was hospitalized at Walter Reed Hospital in Bethesda, Maryland. And that put that company sort of on the spotlight. But phase studies are still ongoing for that. We think that monoclonal antibody is the bridge to vaccine if, for example, there's an outbreak in a nursing home. And that's probably going to be where it's going to be most helpful.
So we all know Gary as our COVID doctor. You came to us at the right or wrong time. But using your other hat, your medical director of quality, what can you tell us about flu and flu vaccine?
Yeah, so we're starting to see just a little bit of flu. There's some sporadic cases. We just had a recent case this week at the Respiratory Care Clinic of influenza A. So still, it's a perfect time to vaccinate. And we're doing a great job with vaccinating our patients, but I want to make sure that we also vaccinate as healthcare leaders and as providers and staff. So right now, we're about 53% of us clinicians have been vaccinated, and I'm really hoping that we get to 99, 100% before the end of the month. Remember, vaccine is mandatory now. The health department for Marin, Sonoma County, San Francisco County, and I think Santa Clara have mandated vaccine for hospital and ambulatory clinical providers. So it's important to get your vaccine. I think it models good leadership.
Well, I just want to finish up with a few announcements of sorts. It's a busy time of year. We're going into the holidays. COVID's still around. Elections, you guys know what it all is about. But I'm sorry we added to that a little bit, but just remind people our Health Stream course that is mandated for everybody in Smugger. We need to finish that by the end of November. It's pretty brief, pretty informative. Remember, this is part of our year-end incentive. That means that you will be compensated for your time. We've also created Policy Stat. The Smugger has pushed all of our policies into Policy Status Depository. And later this week, we will be putting that out to you as well and asking that everybody go to Policy Stat. And we have just a few policies we want you to review that would be very relevant to your status, be a shift worker or a production worker. So that'd be something else we want you to be familiar with, because all policies going forward are going to be on that side. And then lastly, just to remind you that on Thursday, November 19, we have our final on-group meeting of the year. This is also our annual corporate shareholder meeting. We have a lot of things going on that night, elections, information about open enrollment for our medical plan, and some PowerPoint presentations of the year in review. We have decided, since it's November, it's going to be kind of cold and wet, that we will be featuring home-cooked comfort food for your dinner. So I hope you enjoy that. It should be special and probably a lot of variety as well. So thanks for tuning in. This is and will be a tense week for everybody. This is the day after the election. That's going to take a while. So take some deep breaths and go out for a walk. It's still sunny. Thanks.